Quebec's new budget totals over $165 billion in spending, and of that, $65.5 billion is dedicated to healthcare. That's a 3% increase in healthcare spending over the next year for the whole network. That's less than this year's increase of 4.3%. Minister Christian Dubé defended the healthcare budget at the National Assembly.
When you have an average of 3% increase, you need to look at the key components. The key components for me is the services to the population. That's where it's basically the budget of Santé Québec, because they are the one providing the services, okay? That increase at 5%. So to me, that's enough to cover the cost of system and the increase in demand.
But professionals in the network say that's not enough. First, the Federation of Specialist Physicians said it was disappointed by the decision to limit the spending to 3%, which will compromise access to healthcare, it says. This professor explains what a 3% increase means.
They're limiting the growth in the healthcare budget to 3%, which is pretty widely recognized and agreed on that that's not going to cover the rate of growth in healthcare expenditures, right? What we are spending to fund our healthcare system is growing faster than 3% per year. The money will have to come from somewhere else.
In the meantime, professionals in the field have to work in difficult conditions, like in Drummondville, where the regional hospital faced
14 major water break in our hospital in the last year.
The St. Croix Hospital was built after the Second World War and needs to be replaced, but does not figure in the province's infrastructure plan presented in the budget.
Our hospital is too small for the population we have, the Drummondville population.
The new agency, Santé Québec, said it was able to cut $800 million in its attempt to balance the budget. The healthcare system will have to do more with less as the province projects to limit spending growth in 2026-2027.